professionals, I'm going to talk about treatment for recurrent lumbar disc herniations. So essentially, recurrent disc herniations are treated the same as first-time disc herniations, right? That's the key message. So same thing as someone who's had a disc herniation for the first time, we start with anti-inflammatory medications, maybe oral steroids, muscle relaxants, rest for a couple of days, physical therapy, and sometimes epidural injections. And for those where this is not working, we talk about surgery. And again, the criteria for surgery for recurrent disc herniation is also very similar to those who have a first-time disc herniation, meaning we like them to, to try non-operative treatment for close to 6 weeks to 3 months before we talk about surgery. Or if they have significant weakness or have difficulty controlling the bowel bladder, that's when we talk about more urgent surgery for this problem. Surgery typically is again similar. It's a microdiscectomy, a revision microdiscectomy. That's the most common type of surgery. You can expect similar improvement after this surgery compared to the first surgery. However, surgery is not considered beneficial for patients who have basically scar tissue. So it does work for recurrent disc herniations. It does not work as well for scar tissue. For patients who have had more than 2 disc herniations, or who have a lot of back pain at this point due to collapse, as you can see in this x-ray, that's when for a surgical perspective you can consider doing a lumbar disc replacement so that you address their discogenic pain as well as preserve motion. And for patients where there is instability or they have had multiple recurrent disc herniations, the treatment of choice is really to consider a fusion, which is this one, where we clean out the entire disc and do an interbody fusion as well as screws and rods to hold them in place.